Hey everybody, what's going on? Dr. Chad Woolner here.
And Dr. Buddy Allen.
And this is episode 36 of the Health Fundamentals Podcast. And on today's episode, we have a special guest with us, our good friend, Dr. Greg Guymon. And we're going to be talking teens and teeth. So let's get started. You're listening to the Health Fundamentals Podcast. I'm Dr. Chad Woolner.
And I'm Dr. Buddy Allen. And this show is about giving you the simple but powerful cutting-edge tools you need to change your health and your life.
So sit back and enjoy the show as we show you the path to your best life down to a science. All right, everybody. So on today's episode, we brought in a good friend of ours, Dr. Greg Guymon, the one, the only. He is a legend here in our area. In fact, which is really funny, we were just talking before the podcast started. I actually knew Greg Guymon through... we have a local water slide park here, and his name is everywhere. He's got all these all the inner tubes have his brand and logo on it for his orthodontic business. And how long have you been doing that for?
We worked with them. Actually, I treated the director of marketing's daughter.
Oh, okay.
Got to know her. She at one point worked for the news.
Okay.
And then she moved over there. And so it's been 15 years.
Okay. Wow. It's been a long time. So
yeah, almost when they started.
Okay.
Wow.
Yeah, that's crazy. So yeah, for those of us who are watching, just give us a quick kind of introduction about what got you into orthodontics in the first place, how long you've been here in the Valley, kind of a quick snapshot of who you are.
Yeah, so I've been in the Valley actually 22 years as of last month. So I've been doing this for a long time.
Yeah.
When I got here, Eagle Road was a 2-laned road, which is, I mean, that's crazy.
It is crazy.
Around it. And at that time, there was one part-time orthodontist in Meridian, and I came in and said, "Hey, looks like there's room. I'm going to do this."
Yeah.
And so I jumped in full speed ahead, and it's been an amazing journey.
And what,
awesome
25 other orthodontists have followed your example?
I'm the only one. Right? Yes, there's quite a few of us.
And now you've got adults, raised adults from that time on.
Oh, crazy.
So
I'm actually a son of a dentist. That's like a curse word, son of a dentist. And grew up always thinking I was going to take over my dad's practice in Southern California. And I was the only kid that would go in there and actually watch him do things and watch him do extractions and stick my head in there. And, hey, can I watch this? And let me see, Dad. So by the age of 8, I wrote in my journal, I am going to be a dentist like my dad. And I'm the youngest of the 3 sons. And so, interestingly enough, I was the one who followed through and decided I was going to be a dentist. But did your other brothers become anything? So no, not they never. They always knew they weren't going to be.
Okay, just weren't interested.
Yeah, my dad came home happy. He had Fridays off. He enjoyed his work. He wasn't complaining about his job every day. Never had job insecurity issues. And I think that in my head from very early on, it was kind of like, hey, my dad's got kind of a cool gig.
It's a nice life.
He's his own boss, and he can afford things, and we can take trips and things. And I never felt like I was from a wealthy background or anything, but I certainly felt like my dad made sufficient for everyone.
Right.
So anyway, I thought I was going to be a dentist. Went to school in San Francisco for my dental school, and started seeing things in Southern California that I thought, I'm not sure I want to raise a family here. And having moved away for long enough, I realized that there was a life outside of Southern California, which I never thought. I thought it was kind of like the sun and everything revolved around it. So starting at my dental school, I started driving the Western United States saying, I'm going to practice somewhere else and I'm going to be an orthodontist. And the reason I'm an orthodontist is I had an uncle that was an orthodontist. And my dad early on said, son, this orthodontic stuff is pretty interesting. And so I kind of in my head said, I think that's in the background, maybe a possibility. But then when I got to dental school, they told me there's only about less than 10% of the students that want to get into ortho school get into ortho school. So I'm like, oh,
so highly competitive, highly competitive,
super competitive. So I knew right away that I was going to have to be in the top 10% of my class. So out of 80 students, I was going to have to be top 8. And that kind of set the bar really hard, and which made me a little nervous to say I'm going to be an orthodontist or nothing, because there was a possibility I was nothing. And I went to a really sharp dental school with, it was a hard school to get into as it was. So I thought I had passed this great barrier, and I look around and I'm like, dude, I think I'm in the bottom 10% in intelligence level. And so, I just had to work extra hard. And so I ground it out. But anyway, while I was in dental school, along with that, knowing that I wasn't going to be in Southern California, I started driving the Western United States and just trying to, my wife and I kind of created a list of what we considered utopia, what it would look like. And we drove a lot of places, and a lot of places did not look like the utopia we had on our list.
Yeah.
I didn't have any family in Idaho at the time, and drove through here, and there was just something that grabbed me, and I'm like, this is pretty cool.
This is it.
I think I could do this. And it's not very smart to start a practice from scratch. It's much better to buy an existing business, at least from our standpoint. I don't know how it is with you guys, but for sure cash flow's nice.
Absolutely.
And there was nobody even interested in selling. And in fact, I've met a few orthodontists in town, and some of them wouldn't even meet with me. They're just, dude, we don't want another competitor here. And others made it very clear that I would be broke if I moved to town. And I just said, maybe broke, but I might be happy. So, we decided to open our doors just right across the street from where I currently am, 22 years ago.
Wow.
And it's been an amazing ride. Never in my highest expectations, dreams, or goals did I ever think that practicing orthodontics was going to be like it was, the way it is for me.
What do you mean by that? As far as like, what did you think in terms of?
I had a vision of what financially, was going to be enough and sufficient for my needs, and I didn't have those high needs, and I still don't, to tell you the truth. So from that standpoint, I was like, if I make this number and I can pay my bills and pay my student loans, and I can take a vacation a couple times a year, that's
perfect.
What more could you want? And it's far exceeded that. Even just the size of the practice and the. Yeah.
Well, and for those who don't live in this area, what we call the Treasure Valley, which is Boise and all of the pretty much surrounding cities and towns, you'd be hard pressed to, if looking for an orthodontist, not come across Dr. Guymon. His practice is probably the number one practice here in the area in terms of brand recognition. He's just everywhere. You can't go anywhere and not see. And he maintains a stellar reputation. That's something he works really hard for. I've known, like I said, I knew of Dr. Guymon and Guymon Orthodontics long before we met. We go to church together now, and so he's kind of in that realm, kind of a local celebrity in that sense. And we kind of selfishly wanted him here on the podcast for that reason. Truth be told, we told him, you're kind of a legend in that sense. But so in terms of orthodontics, for those watching, what would you say are some things that might surprise people in terms of things you see that orthodontics helps with? Because I think most people from a superficial level get it, that orthodontics is straighten your teeth, kind of like they think of chiropractic in the sense that chiropractic is for your back, which it's true, but obviously there's a lot more to it than that. And I'm confident that with orthodontics, it's the same. So what would you say, number one, are some of the things that might surprise them? Number two, the other kind of follow-up question to that is, what are some things that you love seeing and treating and helping people with, like things that just make you love being an orthodontist?
I guess one of the first surprising things that was a surprise to me is when I first became interested, how long it takes even to become an orthodontist. I went to school for 4 years of undergrad, 4 years of dental school, and then basically 3 years of orthodontic training.
Wow.
So, yeah.
That's a ton of school.
Yeah, it was a long time. What, 22nd grade, something like that?
Yeah.
Grade 20, yeah.
Something.
Graduated from 22nd grade. So it took a long time to do what I wanted to do. It's not a super simple, we just throw on some braces and teeth straighten out and that's how it happens, and it's just so easy. And so orthodontics just doesn't just happen, and you don't go to an overnight school or a weekend school to become an orthodontist, first of all. So that might be a surprise that it's a little more it's a little more rigorous. The
significant amount of training, yeah.
As far as the orthodontics itself, when people think of orthodontics, they think 2 years and it's going to be painful and really expensive. That's what people think of with orthodontics. And, I think we recently did a look back on our past 100 patients that we had completed. And we realized that we had averaged 16 months as our average treatment time, which is very short, much shorter than the national average. Those patients averaged less than, 12 to 13 visits on average. So they weren't coming to our office all the time. And then from a discomfort standpoint, I think orthodontics, we use lighter forces. We use more continuous forces with the new materials and techniques. That's made it a little more comfortable. Are braces uncomfortable? Absolutely. They are a little bit uncomfortable. The first 5 days, I tell you, you're going to be eating,
bananas,
soup, mashed potatoes, bananas, and yogurt, and oatmeal, and applesauce. Yeah. So there's still some soreness, but I think the shortness of treatment is surprising. And our adults in particular who have this concern about straightening their teeth, there's cases that we often do that are 6 or 8 months of orthodontics, and they get this amazing result, and they're like, oh my gosh, if I would have known this, I'd have done it,
I have a question.
Yeah.
Now straightening teeth is one thing, but when you're getting your teeth moved around, does it help with TMJ type issues?
Sure. So orthodontics is, it's way more than just, straight teeth. It's so much more. And that's I guess one of the other things that this leads to is that we're not just talking about making beautiful smiles. If the teeth function properly, sometimes people with TMJ or temporal mandibular joint disorder, everybody kind of has had popping and clicking or pain in their joint. That's a phenomenon that's found in over 50% of the population. We can alleviate that in a certain percentage of those cases, not all of them. Along with that, when we make teeth fit together better, they function better. The difference between someone that functions with a proper bite and the way they chew and eat and break up their food and digest is incredible compared to somebody whose teeth don't.
Do you see it affecting people with headaches at all?
So migraines and TMJ kind of go together, right?
Sure.
A lot of times those trigger factors are related to the joint directly. So absolutely.
I'm curious too. Do you notice anything in terms of improvement with sleep after somebody's had, a course of care?
So I'm a little hesitant to discuss what we can and can't do with sleep because there's
making no claims here.
Yeah.
It's just my concern is that there's a lot of hocus pocus and snake oil being sold out there. Yeah, and I don't. That's not my thing. But here's the deal. So sleep disordered breathing affects a huge percentage of the population. 40% of the population can benefit from a CPAP. I mean, if we put everybody on a sleep study, 40% would actually have some level of sleep disorder, sleep disordered breathing. And it's related to airway. And airway is it's multifactorial, but one of the factors is of course the size and volume of the airway. And we do things all the time like rapid palatal expanders, where we actually increase the size of the palate, which also increases the volume, decreases the airflow resistance. And I have routinely seen young kids, 6, 7, and 8, that we put these in these expanders convert from being a mouth breather with their mouth hanging open to being a nose breather. And as soon as you convert from being a mouth breather to a nose breather, your tongue repositions in a different place, and therefore it reshapes the palate. And I can literally say that, once we fix a palate properly and the tongue goes to the right position, stabilizes the bite, it changes the way they breathe, and it actually changes their facial growth.
So you change their life. I mean, the trajectory of their life. How satisfying and fulfilling must that feel to you to see that, like, right in front of you, like literally, like you've basically put them in a fork in the road and you've completely changed. I mean, and I think maybe that's a good segue too in terms of this, because here we're talking about all these like cool mechanical and or biomechanical things, but we can't dismiss the impact that changing, the alignment of people's teeth and changing their smile can have psychologically on people, teens and adults alike, in terms of their development, in terms of socially that and that impact that has. So maybe share with those listening or watching maybe some of the experiences and or your perspective on that in terms of teens and development socially, you know, the impact of straight teeth and smile psychologically, anything like that?
So we have a tagline, you know, that you just kind of pulled, but it's better smiles, brighter futures. And that's so true in so many ways.
Absolutely.
We were talking earlier, and there have been study after study that have said, you know, what's the number one thing you notice when you meet a new person? What's the number one person, you know, or one thing you notice that stands out? And the smile is always in the top two things, the way their teeth look. And, you know, whether you like it or hate it, in our society, we judge people by the way they look. And you know, maybe that's, well, it is
we judge books by their covers, unfortunately.
It's superficial, but you can't fight it. It's what it is. And therefore, I absolutely, if you can make someone look better, they're judged differently. There's been studies of what you know, second grade, third grade teachers, how they judge their students and who's the brightest. Just you give them a whole pile of pictures and say, okay, here's 20 pictures of your future students. Tell me what you think of each of these. And kids with crazy looking teeth, goofy looking teeth, they end up being judged as, this kid's going to be dumb. This kid's not as bright.
That's scary.
And so they get put in this box of they're not as bright. I mean, it's not just they're not as cute, they're not as bright.
Well, and they've done studies that I'm aware of where they'll tell the teachers ahead of time, where they'll mix students up and they'll put them in the and they'll let people, you know, they'll deliberately say kids that underperform on tests, they'll flip it and they'll say, this kid Johnny here, he's exceptionally brilliant.
Watch what happens.
And then it completely changes. And so the influence or the bias that a teacher has can have such a huge implication in terms of that. So that's kind of crazy.
Here's another crazy study. You can put a baby in front of pictures, and you run by pictures of different people's faces in front of a baby, an infant. And a baby will spend more time looking at attractive faces, and you put an unattractive face and it doesn't hold their attention. They literally look away. And so it's ingrained in us. So it's not just society, it's not just the media, it's not just movies and entertainment.
Right.
It's ingrained in us. We like to look at pleasing and attractive and symmetrical things, and that's what we're trying to do, right?
The cool thing about, you know, way back in the day, having braces was like, for a kid, was a terrifying thought, because there was headgear in some cases.
I had headgear as a kid.
So I mean, there was some crazy, and now with Invisalign and different products that are out there now, it's amazing.
Yeah, no, the days of, you know, the Willy Wonka kid with the crazy stuff on his teeth, those are gone. Our braces are so much smaller. We'd offer, for example, we offer clear braces, transparent braces at no additional charge, that you can be 5 feet away and you wouldn't even know the person was wearing them. And then, of course, about 20% of our patients are choosing Invisalign clear aligners, especially our adults that are really into that. Another thing that you said that's different from long time ago, this stigma of orthodontics being too expensive and not being able to afford it. You know, I talked to a professor when I was back in school, and he told me a story that it just sticks in my head. And he said, you know, I started orthodontics in 1972. He said, this isn't me, by the way, I'm not that old. In 1972, and braces were the same cost as a Volkswagen Bug.
Wow.
So, you know, and he's like, now Volkswagen Bugs weren't the most expensive car, but they weren't the cheapest car. They were the same cost as a Volkswagen Bug. And he said, today, comparatively, braces are cheap. Braces used to be only for the rich back in 1970.
Sure. Well, I think if you get nothing else from that comparison or that kind of point of reference, is that braces have not increased in terms of inflation.
More affordable than ever. Absolutely.
Yeah, while everything else has continued to grow in terms of expense and everything. You know, talking about this kind of evolution of things, how things have changed and whatnot, one of the things that you'd have to be blind not to see, that's a real common trend that we're seeing a lot these days, is more and more companies out there are attempting to cut out of the picture expertise. And braces, I think, to a certain extent, have kind of taken a lot of the brunt of this, in the sense that most people who are listening or watching this have probably seen ads for various new companies that are letting you know that you no longer need an orthodontist, that you can diagnose yourself, or that you can do some sort of a impression. You bite on this thing, send it in, and then their company will basically create the care plan for you and send you the tray full of everything you need or whatever. What's your kind of take on that? Because I know my opinion on that, obviously.
Well, you know, this may sound self-serving, but by the time I'm done, hopefully people understand where I come from and the place that I come from. And that is that, I mentioned earlier that I spent, 22 years of schooling, and specifically I did 3 years of specializing in orthodontics to do what I do. That doesn't happen overnight. And,
right.
And you don't replace that with a do-it-yourself kit. And so, it's really scary to me because there's a lot of things that can go wrong in orthodontics.
Yeah.
The only thing that can go right in orthodontics is the teeth get straighter, and everything else can go wrong. I mean,
right.
It's scary.
Right.
And so to think that someone is handed a piece of plastic that they stick in their mouth to make a sort of impression of their teeth, and then supposedly there's going to be a professional that puts the teeth in the right place, and then the aligners are created, and then they're mailed to the person's house, and they stick them in, and you hope it works.
Well, there's something to be said for seeing the person face to face versus just seeing an impression of my teeth. I think there's
so many more pieces to
right.
to a clinical exam than
right.
that. And here's another thing, that they weren't even required to take an X-ray, so you couldn't look at the health of the bone or the gums. And there have definitely been some negative side effects that are appearing. And just last month, state of California banned this DIY orthodontics from happening in that state without a certain level of records that are required from every other
right.
person doing orthodontics.
Right.
Which why would they have to follow a different set of rules? But their attorneys are very aggressive defending them. Here's an interesting thing that people should know that are considering DIY orthodontics. When you sign with one of these companies, the larger of the companies, you actually have to sign a non-disclosure agreement, an NDA, that says that you will not disclose the contents of what you're signing. And in your signing, you also sign away your rights to sue that company. So not only are you giving up your patient rights that every single healthcare provider has to provides for their patients, but you also sign non-disclosure that you won't tell anybody that you signed away your rights when you started with that company.
So
that's a great business model.
I know. I was just going to say
the aggressiveness of this company when somebody goes out to negatively review them is they send out legal letters on a daily basis.
Wow.
And so I mean that's kind of crazy, because to put that in perspective so that people can kind of understand, that would be like if you were to come to me as a patient at Align Integrated Medical, and we had you sign a form that says, if we hurt you for some reason, which we don't hurt people, by the way, but if for some reason something went wrong where we did something malpractice, right? Because we all have malpractice insurance, right? That you have no recourse,
no repercussions,
and that you, also on top of that, one more layer of protection, you can't tell anybody that you signed this. Like, that's crazy.
It's crazy.
That is crazy.
People don't believe this. I guarantee 100% that this is accurate.
Yeah, that's crazy. So, I mean, at the end of the day, I think the old adage rings very true in this, that you get what you pay for. At the end of the day, I've said this, and I acknowledge full well that we're kind of on the same level in terms of our bias, in the sense that the years that we spend in our training mean something to not only us, but that should mean something else to the public. Look, I acknowledge readily, and I'm confident you're on the same page with me too, that in this day and age, we live in the information age. And so information is readily accessible to everyone. And so we should be prepared as professionals to be able to answer tough questions.
Hey, I saw a YouTube. Yeah. I could do braces.
Right. I watched YouTube. But at the same token, acknowledge and appreciate and value legitimate expertise that is out there. Because there's something to be said for that. Going to a trusted expert, because you're not just paying for the result, although you certainly are paying for the result. What you're also paying for is the confidence along the way of knowing that you have an expert to lean on, along the way. And really, truly, there's great peace of mind. And my guess is, in your 22 years of practice, you've probably fielded numerous phone calls from concerned parents along the way in terms of, this just happened with little Johnny's braces. What should we do? And for an expert, it's a real simple question. It's a simple answer.
You can handle it. Things can go wrong, and things do go wrong. I'd love to tell you that every single one of my patients goes smoothly, exactly how I planned. But guess what? I at least know how to address the problems and fix them and solve them and make them right.
I had years ago when I first graduated high school, I worked in the construction field while I was going to college. And I remember talking to one of the journeymen that I was learning from, and he said something to me that has stuck with me my whole life. He says, the only difference between a journeyman and an apprentice is a journeyman knows how to fix any mistakes. And I'm like, and that kind of what you're saying is stuff happens, and knowing how to fix that and make it at the end result, the correct result it means everything.
Yeah. Well, Dr. Guymon, we appreciate your time here. Dr. Guymon, you're amazing. We love what you do here for our community, and we're excited to continue, obviously, a long, great relationship with you. In fact, I think one of my daughters is going to be starting braces with you in the not too distant future here. For those who are watching who do live here in the Treasure Valley and have questions about orthodontics, about braces, about all things in that realm, how can they get a hold of you? What would be the easiest way?
We're, you can find us by calling our office. That's easy, 208-898-0000.
And we'll make sure we put all the links here. You guys are on Facebook, you're on Instagram.
We're on Instagram. You can text that number, you can call that number. Visit our website. You can schedule your appointment online now. We've just made it really easy, accessible, and affordable to come get treatment.
And quick snapshot: what can people expect when they come into your office first visit? What will basically take place? Let's say that I'm apprehensive. I'm like, I'm kind of scared. Venturing in, I bring my kid in or myself in, and I sit down. What happens there?
Perfect. So our first exam is free. We charge nothing for it. So. That we take out as many barriers as we can. We spend about 40 minutes basically talking to you about what specifically you'd like to see happen, what your concerns are. We take an x-ray so we can analyze the roots and bone structure, and then we just talk about here's your options. And oftentimes one of the things that's new to us is that a lot of patients come in wanting to do something. We get them started that same day. If they're ready for treatment and they want to go, we don't make them schedule a second visit and have to go back and take off more time off of work. We try to make things as convenient as possible, and we just lowered the barrier of entry for orthodontics. So
that's huge.
That's awesome.
So
makes it
cool.
Makes it easy. And I think more these days, cost is only half the equation in terms of concerns. Convenience is huge too. Is big. We noticed that too.
And that's why those DIY companies
they're so appealing.
Proliferated. It seems so great. I can do it from my own home. But please visit an orthodontist. If not me, visit an orthodontist.
Well, my dad raised me. My parents were both very wonderfully pragmatic people, and one of the most common sayings that my dad kind of tried to pound into me as a kid early on is, if it sounds too good to be true, it more often than not usually is, and I've learned that the hard way in my own life, to find that my dad's wisdom was he was correct, most of the time, and that's the case. And so again, the appeal, my friend who used to run the Allstate agency next door to us, he had a saying that said the appeal or the good feel, it was something to the effect of the appeal of a cheap insurance policy fades quickly when your first claim is made, or whatever like that.
Absolutely.
That whole idea that people that think that they got a great deal, that fades really, really quick. And we've said all along, the most expensive option is the one that doesn't work at the end of the day, because it's just wasted money.
That's a great one. I like that.
Do you see a significant portion of people, I mean, not to continue to hammer on the DR way, but do you see a significant portion of people who have tried that option and now it's like, okay, I got to get this taken care of?
I have, and I've corrected more than a handful. And they're always embarrassed. And hey, we've all made some bad choices, and we've always looked for all of us have looked for a good deal, and end up finding out that's not really
human nature.
So I think there's a good point I think that's a really good point to end on, even too, with Dr. Guymon, is that if you're in that boat and you might feel a little sheepish, especially after listening to this episode of the podcast, you're like, he's not going to make you feel stupid.
We don't send you through a repentance process or anything like that.
Right.
We just make it right.
Right.
I don't want to beat up anybody. I just want them to be happy with their smile.
Yeah.
And that's really what we're all about.
That's awesome. And what was the saying again? Your guys' motto or saying?
Better smiles, brighter futures.
Better smiles, brighter futures. That's awesome. Maybe that should be the.
It's true.
It's a good note to end on.
Yeah. Well, Dr. Guymon, we know you're a busy guy, and so we really appreciate you taking time out of your schedule to be here with us on this podcast. So thanks a ton. And Yeah, appreciate you being here with us.
Thanks for having me, guys.
Have a good day.
Yeah,
Absolutely. All right, guys, we'll talk to you later on the next episode. Have a good one.
Thanks for listening to the Health Fundamentals Podcast. Be sure to subscribe so that you stay in the loop and in the know with all of the cutting edge health information that we share. If you know other people that could benefit from this information, please share it with them as well. Also, be sure to give us a review. These really help us to ultimately help more people. Last but not least, if you have questions that you want answered live on the show, or if you have ideas for topics that you would like us to cover, please shoot us an email and let us know at info@thehealthfundamentals.com.